The Federal Ministry of Health and Social Welfare has inaugurated the National Tertiary Health Institutions Standard Committee (NTHISC), which comprises 32 people in the health sector. Welcome to Eco Hot Blog TV. My name is Comfort Olayinka. Stay tuned for more reports. The Minister of State for Health and Social Welfare, Dr. Tunji Alausa, who inaugurated the committee on behalf of the ministry in his address, says the committee has carefully selected healthcare professionals in various aspects of healthcare management. He expressed confidence in the chairman of the committee, Professor Abiodun Phillips, to drive the committee to sterling leadership.
That if we get our healthcare governance right, we will be on the verge of transforming our healthcare system. This committee will be a big part of improving, enhancing, and ensuring we have an effective governance in our healthcare system. This committee was meant to have been inaugurated and active about 8 years ago. We're 8 years behind, but we've been very careful and very meticulous in putting the members of this committee together. And I believe we've gotten it right from the outset, and we will get it right.
Stating the importance of the committee to the ministry, Dr. Alausa says it will help aid the 4-point agenda of the ministry, which is governance of health system, unlocking value chain, and others.
This inauguration we're witnessing today marked a pivotal point at the Federal Ministry of Health and Social Welfare and our entire health sector in the country. As you may all be aware, improving the governance of our healthcare system is the first pillar of our current focus. The other 3 pillars are improving our population healthcare outcomes, unlocking the value chain in our healthcare sector, and also health security, looking at health security beyond physical security, but social and national security. You will agree with me that if we get our healthcare governance right, we will be on the verge of transforming our healthcare system. This committee will be a big part of improving, enhancing, and ensuring we have an effective governance in our healthcare system.
Amongst the function of the committee listed by the minister is to advise the federal government on the financial needs, both recurrent and capital, of tertiary health services, and in particular investigate and study the financial needs for training, research, services, and make appropriate recommendations, and also to set standard criteria for allocation of funds from the federal government to tertiary health institutions and monitor their utilization source for grants as laid by the committee, amongst others.
Some of the key functions of this committee will be to advise the ministers on matters affecting establishment of tertiary hospitals, prepare periodic master plans for the balanced and coordinated development of tertiary hospitals in Nigeria, establish minimum standards to be attained by various tertiary facilities in the nation, and also to inspect and accredit such facilities, among others.
The chairman of the just inaugurated committee, Professor Abiodun Phillips, in his address lamented on the challenges of the federal institutions as enormous, stating medical tourism, Japa syndrome, continuous loss of capable manpower, and others. He also stated the need to change certain impression of the people towards the tertiary institutions by setting up standards to ensure change, as there is lack of trust by the people. Professor Abiodun expressed appreciation to the minister for trusting the committee members to serve the country, says they are committed to achieving the purpose they are appointed for. He appealed for funds for smooth running of the committee, as the committee is a priority of the ministry to ensure the renewed hope agenda of the President Bola Ahmed Tinubu is achieved.
The challenges before our federal tertiary institutions are enormous, despite the significant, although not yet quite adequate, funding that annually goes into the sector. Leadership and governance of these hospitals have also contributed to the current state of affairs, which, by and large, are not acceptable. An obvious consequence of this is the well-known medical tourism, leading to enormous loss of revenue to this country, the Japa syndrome, with a massive, continuous loss of capable manpower in the health sector of this country, and the issues of perennial industrial unrest and the resultant poor health situation of our people. The success of the management of the Ebola and COVID-19 shows that Nigeria has capable hands and can, with good funding, dedication and management, cope with serious health challenges. There's no doubt about that.
The Permanent Secretary of the Ministry, Tertiary Daju, in her welcome address says the inauguration is one of the key steps at rejigging the tertiary institutions. She expressed confidence in the capability of the committee and further assured the committee her unflinching support.
About 2 months ago, I declared open a workshop on behalf of the coordinating minister, organized by this committee on clinical governance for the medical directors and chief medical directors. It was then I realized the enormous potential in the activities of the committee and the need to aggressively support the functions for results. At that time, I had actually assured Professor Abiodun that something will be done, and today, here we are. Thanks to the minister.
Comfort Olayinka, Ecohot TV.